Hey, Dr. Ashley.
Hi.
Okay, I have some questions for you. I know a lot of people have other questions too. So I want to just jump right into it and then you just answer them as best as you can.
Absolutely.
So the first question I want to ask, you told us a little bit about your journey in healthcare, but I really want to know what was your like what and why moment? When did you know I have to become a doctor? Like this is something that I've been called to do, I'm passionate about. Like how did that happen for you?
So I actually, great question. I wanted to be a pharmacist first. And then
Okay.
we like shadowed pharmacists, spoke to some pharmacists, and there wasn't as much patient interaction as I wanted. There is patient interaction in pharmacy. Don't be discouraged if you want to do pharmacy. It's just not as much as I wanted, and so I decided that being a doctor in some ways is similar to a pharmacist, right?
Mhm.
But there is definitely more patient interaction, more discussions with patients, and so that's what ultimately led me to say I have to do medicine.
Mhm.
Um, and I did shadowing as well with my local pediatrician, and that's when I knew.
Really? So shadowing definitely helped you to learn. Because
Definitely.
I know right now, like I'm in my third year of undergrad, and so I've really been doing the whole big debate, the PA versus MD route. And
Right.
so shadowing, I've shadowed a doctor and I've shadowed a PA, and I feel like both are important, but I'm still waiting for my moment where I'm like, this is what I have to do. So I'm glad you had your moment.
I would say I'm like someone who believes in God. Pray
Mhm.
about it will be
Yeah.
crystal clear if you ask God to specifically say, pray, reveal to me which direction I should go. I will say people always say, you know, why one over the other? And I think there's a lot of factors that go in, including less training for the PA route, and you can switch your specialty. But also, as a doctor, you're like the leader of the team. Um, and you really, really specialize in what you decide to do once you do your residency. And there's certain jobs that you can only do as a doctor. PAs are wonderful and amazing, but that is kind of like the difference.
Hmm. Yeah. I think your journey is especially unique because most people on like the pre-med MD track are like, I've known I wanted to be a doctor since I was 4. I came out the womb knowing that I wanted to practice medicine. And
I
you were like,
everything else. I wanted to be an architect. I want to be a psychologist. So they're all like STEAM jobs, but medicine. I didn't even come to a pharmacist until maybe high school, and
Mhm.
I think that was a little bit of like everyone else was like I'm gonna be a doctor, and I was like, well, what could I do? What? And I kind of came up with pharmacist, and then ended up in medicine. So be open minded,
Yeah.
when listening because I was all over the place.
Did you grow up with any like healthcare professionals in your family?
No, so I'm the first doctor in my
Wow.
family, third cousin. We've kind of gone through it, and there's no other doctors in the family. So, I actually, it's not like I took a different path. Um,
Hmm.
it just come from a family who my dad was the first person to finish 4-year college on his side of the family, like the immediate family. My mom, she came from a family that was of educators, and so combined together,
Hmm.
we just the history of Black people in this country. We know that education access is something that has long not been available to all, but has changed over the last generations. And so I'm the generation who kind of broke that mold for my family. And now anyone who comes after me will have advice from me and support from everyone else because they all kind of know what it takes now. They're going to be
Right.
missing weddings and missing, important family things, but ultimately, be able to achieve their dreams if someone else decides to be a doctor. So
Absolutely.
be like a blessing But I do think that people who have family members, like my husband, all of his family is doctors. I do think that there's something special about that because there's a lot of unsaid in medicine. That's why I have a podcast myself called Real Medicine with Dr. Rox to
Yes.
help people understand some of the things that are unsaid, that they will encounter in medicine to help them understand more about the uh, ins and outs.
And I want to get into all that too, but I'm glad you dropped your podcast. I'm actually going to pin that in the chat. But so your specialty is family medicine, right?
Right.
Okay. So I know that a big thing you must work on, of course, being in family medicine, is preventative care. And so my question to you would be, what is what is a way that African Americans specifically can practice like preventative medicine now so that we won't see so many chronic diseases that we have, like, diabetes, health concerns? What are some of the things that we can practice now?
Right. So I think a huge thing, especially as a family medicine doctor, is so many people do not have a primary care doctor. They can't say, this is my primary care doctor. This is who I go to when something's wrong. A lot of people end up, unfortunately, going to the emergency room, which is just not long time preventative care. It's usually acute care. It's usually treating one ailment. And you need someone who you can have conversations about what it looks like for you in 5 years when you want to get pregnant, or what it looks
Right.
um, when you might be struggling with weight gain, or from the freshman 20, more like the freshman 50 these days, um, or what it might look like when you're going through a hard time, depression, anxiety, especially in this past pandemic. So having prevention, I think it's very important, and that kind of starts with like a primary care doctor. This is where I think PAs come into the picture, because I do think you can receive preventive medicine from a nurse practitioner, a PA, a primary care doctor, an internist, which is internal medicine. It's more so just having a doctor that you call, or provider that you call your medical professional.
Mhm.
Really important. That's number one, which means that you have to have access to insurance or pay for insurance. So that's a whole conversation that I don't want to get into, but just having insurance and a primary care doctor, I think something like 40% of people haven't seen a primary care doctor in the last like year or two.
Wow.
Huge in America, that people, follow up with your primary care doctor if you do have one as well. I think another thing that's important is what we eat. I'm guilty of this as well, but it's all about balance. So my favorite restaurant, top three, is Waffle House. But I'm not eating Waffle House every day. So it's all about balance. So I'm eating it like twice a month, sometimes 4 times a month. But on the other, I'm eating pretty good. And the reason why I say Waffle House is because it's like waffles, which is like carbs and bread and
Mhm.
syrup, and something that is not that great. Um,
Right.
but it's not like a 4 pound cheeseburger either. It's like in the middle somewhere. But it's something that people would say, oh, it's just Waffle House. I eat it every like multiple times a week. But it actually, when you eat like that over again, you're putting your body more at risk for diabetes, pre-diabetes, obesity,
Right.
um, those type of things that we have to throw a salad in there sometimes. And
Mhm.
I know there's like a new like body positivity, which I believe in 100%, but more so of like, it's not about the body and how the body looks and weight for me. It's more so of what it means when you are eating things that we know are bad for you. That's what
Mhm.
it is. It's like the food that we're putting in. And unfortunately, some of those foods lead to weight gain. They lead to
Mhm.
obesity and things, and diabetes. And so eating more greens, eating more fruits, staying well hydrated. That's another thing that could be preventative if you are someone who eats like a lot of salt.
Yeah.
The best way to dilute salt is with water.
Water.
Yeah, and
Yep.
you need two kidneys, and they'll flush it all right out. It's not the cure for high blood pressure, but it's definitely something that can help people who want to be preventative.
For sure. And so, Dr. Ross, before I say my comment, there is a question I want to ask. So, or there's someone posted in the chat. It says, what do you do when your PCP, your primary care doctor, will not refer you to a specialist?
So I think another thing that's really important for Black people is finding someone who listens to you. There is bias in medicine.
Hmm.
I feel like you're stuck. You can establish care with a new primary care doctor and someone who's going to hear you out. I will say that sometimes I do encounter patients who I don't want to refer them to a specialist for multiple reasons. Maybe it might be for a copay when you believe that you can help them. Like sometimes the number one that I get is dermatology, which often has a high copay or does not accept copays and ensures that all you have to pay cash.
Mm.
Um, when I could handle the dermatology, depending on what it is, the dermatology treatment plan. And so I don't feel like there's a reason to refer you out. But if we try a treatment plan and it doesn't work, then I do think that it would be appropriate to refer at that time, depending on what is going on. It's hard to give advice about specific ailments, but that's like the big one.
Hmm.
As well as you shouldn't feel stuck with a doctor that you don't think is listening to you. That's what I'm gathering from your question. So I would establish care with a new doctor. Hopefully you have access to another doctor in your area. And
Hmm.
if not, there's so many different search engines these days about who's taking insurance. Slowly just transition. Start now, right? So you know that this doctor is not listening and will not refer you to a specialist. So get an appointment, and maybe appointments are 2 months out, but that's fine. You're
Right.
on the track to change.
Hmm. Yeah. Do you notice yourself, because I know that you're a doctor who is in Atlanta, Georgia, do you feel like you notice a certain demographic coming in more and more in family medicine, or is it kind of everyone?
So in residency, I would say that is basically a lot of Black patients for me, and because where I went to residency, that's kind of the mission is to help underserved, is to help people who live in the West End,
Hmm.
and most people who live in the West End of Atlanta are Black. But I do have patients of all backgrounds, Middle Eastern, Caucasian, Asian. I've seen them all. It's just that mostly in the West End, the residents there are Black. And so they actually are the people who make up our clinic, but it's different across Georgia and the South because of what the statistics show us that unfortunately just Black patients are not as likely for multiple reasons to have a primary care doctor. And that's what I'm trying to change.
Yeah. Why do you think it's so hard for us to have primary care? Is it we're just being hard-headed? Like, what is it?
And I feel like a lot of people say like hard headed or reluctant but I think there's real fear in the Black community, and it's two things. I was a medical anthropology major in college, and so it's like the study of culture. Why do we do what we do? A lot of people, they haven't seen their parents go to the doctor. How many people can say that their father they saw growing up, they saw them going to the doctor often? A lot of times, the best time for a Black patient in some ways to access care is when they're a kid because they're going all the time to the pediatrician. They're going all the time for sports checkups. Then they kind of get like not lost to the system, but we don't see them as often, and then we kind of
Right.
in when they're older. And so that time frame in between is the time frame that I'm hoping more people, even when you're healthy, you get a primary care doctor
Hmm.
because what you think is healthy might not be. You might have pre-diabetes. You might have which doesn't have many symptoms. You might have high blood pressure, which also is called the silent killer.
Hmm.
So I think it starts with like learned behavior of if you haven't seen your parents or even your aunties, uncles go to the doctor. I'm going to my checkup today. Where do you learn that behavior? I think another reason is just like systemic reasons, whether that be less income overall across America because of the lack of access to jobs, because of bias, because of the prison pipeline. There's just so many reasons, especially for
Yeah,
girls. Um, Getting health care in prison is different than getting health care out of prison. So
absolutely.
a huge factor that
Hmm.
maybe not everyone is thinking about when we see like, oh, Black people are less likely to have a primary care doctor, but things that really affect how people have access in society.
Right. I want to ask you a little bit about representation as a Black woman in your field. So, do you feel that when you began your medical journey at 19, I want to keep saying that because that's amazing. Did you feel like you had representation from your attendings, your other resident or other, people, other people in your class, and then your mentors? Did you feel like you had representation of other Black women?
Yes, I would say that I specifically chose places where there were Black women specifically in leadership. My
Hmm.
residency, the chair is Black, the PD is Black. When I came, the assistant PD was a Black woman, all Black women. So those are the top three in our um, program. So, and it's for me about representation. It's about knowing that they came before, and even like their boss is a woman, the president at my residency. So, Black women. Being represented in places I go is very important. It's something that I do think about. I'm not big about like name. I'm
Hmm.
big about experience. I'm big about what I can learn there. And so I have over time, even like in college, always tried to choose places where I had Black professors in undergrad. I had Black people who were doing great research around the country. I had Black doctors that I shadowed, all Black. Well, that's not true. um, Out of three doctors that I shadowed, two of them were Black women.
Hmm.
So it was very important for me, I think, to have that because I didn't have anyone else in my family, woman, man, that was a doctor. So just knowing that I could do it, because you will face a lot of obstacles in medicine, and so
I
it's
hear that a lot.
just know that you can keep going, keep doing. Yes, it's very important.